should be good. I just wanna make sure I'm following the rules.
Yeah, I like that.
You want to go switch him to after the minutes?
Yeah, we'll do him and we'll do,
Right.
the county administrator.
And his name again is
What is your last name again? Smith.
Smith.
I didn't even realize you were on this.
And that's about permits?
Yeah.
Yeah, well, yeah, it's like still,
That's what?
I don't recall if we gave an extension or not. I'm trying to look at the minutes. I don't remember what the extension was. We gave him one. I just don't recall. So I'm looking real quick to see.
There's
I'm not
about-
saying we didn't give you one. I'm
It's
just trying to make
about
sure it's right
permits.
before I go say it is.
Yeah.
Yeah.
They were covering the permits, the only thing I would have to do is be a
Well, I mean, it'd be funnier if you
visit the site.
For construction, for water, for
Yeah.
New home, right?
new homes, okay.
I don't want that responsibility.
And your name is Dawn?
Yeah.
I guess you didn't see the shot that she had.
And when I got the extension, you know, the net is used the same permit date.
Yeah,
Oh, do
yeah.
you really?
I just wanted to start using this right.
Yeah, it seems like
We're all on the same page.
A lot of people don't need to have the surgery. It was fine for like 18 months and then it's not anymore.
Very fast.
Yeah, definitely. Oh, you've been doing good.
I feel like I need to get more because I just do like spend.
Don't forget my meds. It's like you can say you said blurs together. That's like, 2 hours off.
Yeah, so I'm gonna look and see if I can find the fire. All right, go ahead, sir.
It's like,
It's fine.
Yeah.
Let's say good evening to everyone. This is the July 24th, 2024 Geauga Public Health Meeting. It's 5 p.m. We'll call the meeting to order. And at first, an opening of the meeting, we'll stand up and turn and pledge allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And we have all members, so we can declare a quorum, and we can certify delivery of the official notice of meeting.
Certified they were delivered.
And the next element will be regarding the meetings from the regular meeting, June 26th of 2004. Does anyone have any corrections or reviews?
No.
Nope. None. So we need a motion to,
I move to approve the regular meeting minutes from June 26, 2024.
second.
so we have a motion and a second, so they are approved.
We need a vote still.
Oh, so votes,
You can just, yeah.
yes?
If yeah, because some of you guys weren't, yeah, so, Ms. Jones?
Yes.
Ms. DeBooth, is that?
Devon.
Oh my gosh, all right. Even when I try to spice it up, all right, Ms. DeBoth. Ms. Brakey?
Yes.
Dr. Rude?
Yes.
Dr. Henderson?
Yes.
I tried to guess it. It didn't work out in my favor.
So the minutes are approved.
Yes.
And then with two different groups, we're going to change the order of business.
Yeah, if you would so entertain, jump up the members of the public here, just so they're not sitting through. So the first one we do is Mr. Ken Smith here. Now, really quickly, Ken, I did look up in December you were here, and the board did not extend the permit. So in the minutes that are out posted on the website, they did agree with Dan Lark. You have to obtain a new permit.
That's not what we did in December.
That is what's on it. So Ken was the one that in 2019 had a permit. Those can be extended up to, they're good for a year. They can be extended for 6 months more, which Dan does on occasion. And then after that, there's not really a way to extend those after the 18-month period. Ken came in December. Now, per our minutes, I'm not going to read the end. There's a whole paragraph. I'm just going to read the end where it says, as this permit expired 3 years ago, Dan Lark, it says he, but Dan Lark recommends not extending it due to the 18-month rule. The board discusses the fees of the permits and the health department's role. Dan Lark said technically the permits have expired. At a minimum, the state fees would have to be collected again, and a lot of work would have to be done. And that's because the state fees are not under our control. Like, we have to pay those each time. And I said the board agreed with Dan Lark's recommendation. The homeowner will have to obtain new permits. So that's what's in the minutes from that actual meeting, and that's what Dan and I had recalled, but I hadn't actually gone back and looked at those, not knowing if you were here or not. So that's where we're at right now. I mean, would you like to address I'm guessing you want to address the board, but
Yeah, you know, when COVID hit in January, I think we were ready to start building. And then they shut everything down, the banks changed the rules on us, and, you know, we had to wait it out. But everything was paid for up front. And, we recently followed the bank's rules, got them all done, we're on board, we're already started building. The basement foundation should be done next week. The building department, the zoning, they're all honoring my permits, and when I came here, I pretty much thought that we,
Yeah, when I talked to you on the phone, I was pretty sure, until we checked the minutes, I was pretty sure that we did not do that at that point, as I told you on the phone, but, yeah, I knew you were sure they did, so.
Don't recall you telling me that.
Yeah.
The only thing that I heard was in that meeting was to come back, that we'd have to pay a few $100 or a couple $100 to come and revisit the site. So I wouldn't have to go through all the stuff again. So now I'm hearing a different story today. So I don't know.
so what I can
No, I
do, it wouldn't be something we handle today, but we can always go back to the YouTube video. 'Cause I'm not going to sit here and listen to that while we're in the board meeting, but I can go back to the YouTube video and just check exactly what was said throughout, because it's all recorded.
Sure.
I think there's some of the fees we charge, we can not charge, like the lot evaluation fees, because we've already been out there, we've already have approved plans and all that stuff, so there's no reason to charge any of those fees at all. But most likely, the permit is probably the one I would have said that we probably still need to charge.
And how much is that? I don't remember, it's been so long.
I believe the total thing would be $974.
I mean, I don't have a crystal ball, and it ain't my fault that COVID hit and all
No, I
this
understand.
crap, and now I gotta pay a second time.
But
That's what you guys are telling me?
But there's employee time that has to go into that fee as well, right? That needs to be duplicated.
Yeah, so.
That was my memory from December.
Yeah,
And so if we don't charge you those fees, then essentially everyone else has to pay for, your situation.
Yeah, but I paid for it once, I gotta pay it again.
Right, because the
Well,
employees
no,
have to redo the work.
There was nothing done, right?
That's not my understanding.
From the permit, I already paid for it once,
So
the work's done, that's right.
yeah, I understand, but, permits have a term that we have to expire them in.
And again, COVID hit, and I couldn't do it.
I understand.
So I'm gonna get stuck again? Is that what you're telling me?
Well, it'd be up to the board, but I think once they're expired, there's a time limit on the term when you take the permits out.
Yeah, I understand that,
Yeah.
but I'm trying to tell you, COVID hit, and it shut the country down.
Yeah.
And now you're telling me I gotta pay it again?
Well, I think we need to look at the video. If we made a decision, it seemed like everybody was in somewhat agreement at the time. So without that, I hate to conjecture what is or what's not.
I'm trying to find it.
And we did not vote on this, so did we? This was just,
From what I can tell, it was just public. It was public
Okay.
comment, and you just upheld that, with what Dan said, because like Dan mentioned, some of the stuff is state driven. How we have to charge it, we don't. It's like food fees is a better example, but food fees, like, we don't have a choice with those. They are charged. You can be a day late, you still get charged per the code. Otherwise, we get cited for that. We get citation for it.
and I empathize completely. Unfortunately, I just have to abstain from any discussion or decisions on this just because of the issue of septic. So I don't, I apologize for sitting in silence, and I do hear you, so.
I mean, nothing's cheap anymore. You wouldn't believe what it's cost me, but it doubled the price of this house. Now I gotta come up with another $1,000? For what? Because of a piece of paper?
Yep, and also, just equally applying our practices, there's lots of people that we actually charge late fees or have
Be in the same
denied their,
situation.
turned down disapproved permits because of the same situation. So, based on current practice and procedures we do, there's lots of permits that we actually disapprove based on time limits and stuff like that, because people don't do what they're supposed to in the time limit, and there's time limits on the permits.
But to the extent there's any cost savings with Mr. Smith reapplying, we can apply those to.
Yeah, so the whole lot evaluation typically is 170, I think, off the top of my head.
Okay.
And there's no reason to charge that, again, all that would, this plan he submitted and all that would still be the same.
Things we waive, we can waive.
Yeah.
And I'll go through the minutes, I'll send you guys out if something is different, I'm trying to find it in the video with captions on, just not finding it.
We have a full agenda, I think we should move on.
Yeah, so,
Yes.
Do you know what month it was, Adam, you said?
what's that?
Do you know what month it was?
It's December, I mean, I've got the video up, I was just trying to figure out where public comment was, it wasn't at the end. Mr. Smith, if you'd like to call myself and Dan, Dan will be in tomorrow, I'm out, but tomorrow, Friday, so I'll go through I'm gonna scan through the video as we're talking, but I'll see if I can find it. And then next, we'll let Linda and Mr. Dvorak, I know Linda's speaking, but Linda, the Deputy County Administrator, and then Mr. Dvorak, County Commissioner, are both here to discuss rent, would be my best guess. And I did send the draft lease agreement out to everybody just to have a review. As I mentioned, it's not going to the county prosecutor, so you guys can't sign or agree to anything until they've reviewed it and given us the go-ahead. And then obviously you guys have not had time to discuss it, which I relayed to Linda, as you guys have not had any time to discuss it, any time to talk about it. So now would be the time, so I'll leave the floor to Linda for right now, and then we can jump into the board with some questions as you go through.
Okay. Basically, we drafted a lease. I sent it a month ago, but it hasn't been looked at yet. So on the advice of the county administrator, he said, go ahead and send it to you guys so you can at least see what we've proposed. And then you can give us reaction to what we presented to you. If there's something else you want to see in there, or if you have questions about anything you see in there, you need clarification, this is the time for you to tell us. Actually, I thought you would talk and I would listen. That's okay.
Who drafted the agreement?
I did.
Okay.
No, I'm not an attorney. It's based on a lease that we had. It's Laura's lease, basically, for a different thing, and I just changed the terms in it to meet your situation. I was hoping that she would find it easier to look at, but she just hasn't had a chance to get to it yet.
Okay, so the prosecutor has it look at it on either side, I guess.
To my knowledge, no. And that's not unusual practice for our office, for us to draft something and then we send it to them and then they tweak it however they want it to look.
So the 6,721 square feet, that includes the storage area in the basement and does not include the lunchroom and the storage area on the third
Correct.
floor?
Did you get the attachments? Because there's floor plans as exhibit A and B or 1 and 2.
I mean, to be honest, I scanned through this, so to the extent that's
I did not see
in
it in that original.
yeah, I don't recall, I didn't print them out if they were
No,
included.
maybe it might have been a separate document, but it was not
Should
in
have
that.
attached to it. That's the floor space upstairs and that's your storage space in the basement.
Here, Carolyn, while you're on the thought, I'll have, if you wanna go.
No, that's okay. I mean,
Okay.
that was my assumption, is that's what it cost. So I mean, I was a little taken aback that we would be charged the full price for the unfinished storage area in the basement, the same as the finished space on the third floor.
Well, it's $2 a square foot, that's pretty reasonable, but we can talk. What would you like to see instead?
What's $2 a square foot?
In the first year of the contract,
In the
it's
first year of the
$2 a
contract,
square foot.
First year.
But then everything goes up.
Yes,
Okay, so I mean, my proposal would be that storage area should be at a lower rate.
for example.
For example, $1 a square foot.
Okay, we can ask the other board members how they feel about that.
And I mean, I was under the impression that the storage area was included, that was an add-on, just like we're not paying for the lobby space, for example.
Well, but the lobby is shared by everyone.
Does anybody else share the storage space
No,
downstairs?
that is your
We're the only ones
exclusive
who
lot.
allowed
And that's
Well, so
specific
each one has
space.
their own storage space.
So is
It's not
anybody
just
else
one
charged
wall.
for the storage space in the basement?
Other people are charged in other ways. For example, Soil and Water has space down there. Honestly, I have never seen their agreement, so I don't know what it says about that.
But the state pays for their agreement.
Yes.
Just to be
yeah.
clear,
It's like
versus
$18 a
ours.
square foot, and
And
this is much more reasonable than that.
It's
On
just
that
not
diagram
apples to
of-
apples, is kind of the point of, finished space with carpeting, you
Right.
see in this versus unfinished storage space,
Right.
Understood.
yeah.
And on that
diagram where it says soil, that means that is soil that's sitting right next to our space. There's something that says soil.
It's
That's the
soil
soil
and
and
water.
water department.
It's a department. It's
That's
not
their
actual
storage.
soil.
It's not
It's
actually
not
soil
dirt.
sitting.
Is that what you, it's
But
not a
they're-
box of dirt.
It's the good dirt, they only use that on special.
But they don't have any equipment or fuel or
I
supplies
have
in
no idea
there.
what's in their space, because that's their space. I mean, I can ask them if that's something you need to know about.
I think it would be, in
Okay.
fact,
But for leakage and damage to,
if we have records,
the
paper,
archives.
right, archives.
Well, the archives is right on the other side, so,
I think they're
But-
referring to our archives.
Yeah,
I mean, but, you
Yeah,
know,
yeah.
county's archives are
Archives,
down there
archives is
too.
next to us, yeah.
so
And
if there's
just an
anything
internal
within that
question.
soil and water that potentially could damage,
I can
either of
ask,
the
but I will
archive
tell you, I would
collections.
be extremely surprised if there was. Are you looking for $1 a square foot for that in perpetuity?
Yes,
You have not, because you asked not, right?
Well, no, but, I mean, that's, true, and one of the questions I had, you were talking about in perpetuity regarding that space, but and again, this may be similar to other agreements and standard lease agreements with the yearly increase though, but is there a cap on that? So let's say, yes, this is a 5-year term, what happens though, after that, like, I know it's a renewal of agreement, but are we going to continue to see
it's
increases
just a
on this?
1-year renewal, and then we'd have to renegotiate the entire lease after the end of the term. That's how it's currently written.
After 5 years.
Yeah, so I mean,
But the yearly
But that's
increase is
not-
I think it's
that's
got,
not
automatic, right?
I think it's got an automatic 1-year.
that's what I'm saying, and there's a
Yes.
1-year automatic renewal,
But
and
the
then
point
after
is
that, you have to
yearly, we are
negotiate.
increasing from $1 to $2 to $3 to $4.
I think Ashley's concern is like, will be, 10 years will be $15 or something like that.
Right, there's
It's
just no
gonna-
cap.
Yeah,
The rent amount is based on what it costs us for you to be here. In terms of, we're paying your utilities, we are mowing the lawn, we are clearing the snow, we are providing custodial that, as far as I know, and if we're not, please tell me. So, this was, the reason we didn't approach you about rent at all for a year was because we wanted to wait a year to see what it costs for a year. And it was calculated out to, $3 to $4 a square foot. And so I would say in 5 years, I don't know that I will be here, I'll be really old by then. But somebody will be here, and I think it would be fair to go back to the well and see, well, what's it costing now? Because it won't be the same as what it costs now.
Correct.
And we're offering $2 and $3 for the first couple of years that we're still taking a loss for you to be here. We're still supplying you with services and utilities and what have you, and nobody knows better than you what utility prices may do,
well,
so.
yeah, we can talk about that at a different time. The other thing that really, I guess, took me.
Before we leave that,
Okay.
can I just
Go ahead.
say that if that is the expectation that, because that was my understanding talking to you guys, that you were, or whatever was proposed, that it was based on the cost of operating the building and our share of that, tenant's
With
proportionate
no
share.
capitalization costs at all.
I understand.
People who are paying cost allocation are paying capitalization costs as well, which is what it costs us to build the building
Right,
expressed over time.
but we're a public health entity like you are a public entity as well. And when we send out a bill for services that we provide, like a sewer inspection or the like, we're not allowed to make a profit on that because we're a public entity. And so I don't see necessarily why it would be in the county's interest to make a profit on us being present in a building that was already financed by the bond that built the building, correct?
I don't understand why you would think we are making a profit from it.
Well, that's what I'm trying to.
That's the question, I think.
Well, it just came up as a question in my mind because of the way the rent went up from $2 to $3 to $4 and seemed to be a pattern that could be taken into perpetuity. So if it is our mutual understanding that the rent should be proportional to the cost of actually operating the building, then it would seem to me that there should be able to be at least proposed a formula for how future rent increases might be able to be determined. Like there is as you were stating, an assessment of the actual true costs of renting the building, and then that should be then proposed to us as saying, based on that, then this should be what your rent should be.
I was answering her question, let me be more clear. My expectation would be in year 6 or 7 or whenever we come to the end of this thing, that we would go back and look at everything again and see how much is it costing us now to pay the utilities and plow the snow and all those things. And then that would be the basis, I would suspect, for, would you agree, Commissioner?
We could also put in there that, just like a house mortgage, a balloon interest rate or whatever, it cannot go any more than so much percent for the next 3 years, after the 5.
So a follow-up question to that is we talk about the cost displaced across, you know, the entirety of the building and the people. Now, I know that they're not all paying rent to you. However, if they are paying rent or the cost is displaced across every, you know, individual entity inside this building, are we paying a larger chunk of that, or is it equally displaced? Like, does that make sense what I'm asking?
It's sort of like
Is
in
there-
a proportionate share. If we have 8% of the building, then we should not be responsible for more than 8% of the,
You're being charged on a square foot basis based on the number of square foot you have and what it costs us to buy the square foot to have this building.
But what percentage of the outside utilities you mentioned though is on top of that? Because that's not necessarily square foot.
It's not on top of it, that's included in it.
Right.
You'll see in the lease, it says the lessor pays the utilities, that's us. That's included in, that's why it's so reasonable. We're just trying to be made whole for what it costs for you to be here, and there is no profit.
Right.
Again, no capitalization costs, which are cost allocation, like GFS and Water Resources and Department on Aging, they're paying way, way more, because they're also paying for the capitalization of the building.
Well, and I think that's kind of the answer we were wondering about.
right.
Yeah.
I think that's what we're trying to confirm.
Right.
Okay.
We're both speaking the same language, I think.
English and English, yes.
We're
So
both in the
for
service
prac-
industry.
Yes.
Practically, is there a range per square foot for this area?
What do you mean?
Is,
Like
some people pay
comparable?
$2, some people pay $1, some people pay $10, some groups?
BMV,
Per square
what do they
foot.
pay?
$18
Currently,
a square foot.
Is there a range on the square foot cost
No,
of this area?
no,
Everyone pays $2.
no.
No.
Let me try again. Not that many entities in the building pay rent in this way. BMV does, I don't think the clerk does. We don't charge them anything
No.
that I know of. I don't know if they even pay cost allocation.
But periodically, the clerk gets so much for fees, and when she moved in here, they wrote a check out for $750,000 for their share and expenses and stuff, and it was like and maybe in 2 or 3 years, she'll write another check out based on fees that she charges. So that was
The
a
large
welcoming check.
agencies that are in this building that receive federal funding are required by federal law we have to have a cost allocation plan. And we hire an outside consultant to help us with it because it's an extremely complex process. And they come back with, here's how much for what GFS has, they have to pay. Here's how much for what Department on Aging, because they get federal funding. Water Resources gets federal funding. And they all pay, I think it's quarterly, cost allocation. It's a different calculation than what we did to try to figure out what your rent should be. What we did for you was just, what does it cost us on a square foot basis to run this building? How many square feet do you have? $2 for the first year is half what it costs us. $3 for the second year, less than it costs us. And then, again, when we reach the end, I would expect they would do a similar process. What is it costing us now? And then something similar.
But again, practically, the question is, of those people that pay rent for that area, what is the range?
We are lower than,
Yeah, we're at the low end of the range.
we're at the low end of that.
And I
So
think
what's
there's
the
a bunch
other
of
end of
different
it? Just an,
structures.
Right, I-
$18.
Someone who
Don't
actually
understand
pays
that.
rent, which is BMV, pays $18 a square foot.
Right.
for
I
this
wanna say
area?
Soil and Water is paying about 14 a square foot, but that, as you said, is reimbursed by the state.
Right,
Which, so they knew what they could get, and then they
Right.
agreed with us, that's what the rent would be that they would pay.
So there's different rental agreement structures in
Correct.
place
Right.
based on the
Not that
reimbursement
many.
model.
Most of the big square feet people are paying through cost allocation.
Got it.
right. And currently, is there anyone who's paying $1 per square foot?
Oh, no.
Okay.
Okay.
Okay, so moving on, the one thing that stood out to me as being significantly different than what we've talked about in prior conversations is the start date is September 1st, 2024, and my understanding was it was gonna be January 1st.
I had no idea about a start date. I don't know where January came from. I just threw that in because I had to
Okay.
throw something in.
I believe
think
when you
that's
and
feasible.
Jerry came in earlier, that this
Yeah.
talk was that it would start next year, not this year.
Correct.
I mean, and part of the issue is we have our budget set already for this year.
Right.
So
We have our
this is
budget set for next year too.
Well,
Our problem,
that one's a little bit more reasonable, but.
our problem is, we have to find a place for ADP. And the sooner we can find that place.
But we
the
can
better.
still execute that agreement and not be paying rent.
What do you mean by that?
Until January
exactly?
1.
Yeah, we can execute it, we can make a motion to hand over that space, and we can separately execute an agreement that starts January 1.
Okay, you're open to that?
Yes.
What would be a date that you would be comfortable with, that we could start working on the space so they could move?
What do the logistics of that look like in terms of?
I mean, the logistics is moving the lunchroom over to one of the medical rooms, for lack of better words, one of the intake rooms. So be moving some of the lunchroom area over that, be knocking a wall out so that we can get to the restroom still.
Question.
Those are probably the biggest
That's
ones.
the rate limiting factor
Yeah.
there is the construction and things like that, so I
Yeah.
think
I mean, right now.
don't think maintenance has done anything about engaging a contractor yet, because they were waiting to see how everything
Yeah.
was gonna shake out. I do believe the doors were ordered because they take so long to get.
Right.
Yeah, I think last time you said those were ordered, if I remember correctly.
Yeah, but when I asked him, he goes, well, I think he ordered them that week after I
Okay.
talked to him. So we're probably still a month or two out before we would even have the doors. And that's the key thing, to keep you guys secure.
Yeah. I mean, the doors, I mean, while they are important, I mean, in terms of if you started working in the ADP space tomorrow, I'm just saying tomorrow, then, you know, we would need access to our restrooms and the lunchroom stuff if you switched over. That's the stuff that, like, you know, even if they're doing construction today, it would have to be moved before they start
You
construction.
have to cut that door through.
Yeah.
So
Yeah,
you can get to the
that'd be number
bathroom.
one.
Yes,
Yeah.
and number two.
You're so picky.
I gotcha.
But to be clear, I don't think we
Terrible
should be,
dad joke.
I don't
Terrible.
think we should be handing over that space until this is ready, I mean, pretty
Correct.
much ready to be
Correct.
executed, which to me, it's not right now.
Correct.
Well,
Yeah,
and
well-
we have no control over when the prosecutor will return it to us either, so.
Well, I understand,
Yeah.
I understand.
Yeah, and legally, well, not I. Yeah, I believe it's legally. You guys can't enter into a contract without their approval, anyways. I mean,
Right.
financially, they won't let us pay the bill anyways, and that's the auditor's perspective. Is without prosecutor approval, you can't pay the bill anyways, so we can't encumber the funds. Whenever we decide, or whenever you guys decide the start date is, though, the reality is Mr. Larkin and I will have to relook at fees because that's going to have an impact on the fees that we charge.
Right.
And then also, I'm sure Mr. Graham will at least somewhat state on it. Accreditation is coming up. That's $70,000 to $80,000 a year that we have currently not been paying in costs. So that's going to be included as well. So there are significant costs that are coming up that have to be incurred.
Okay.
So
Regarding the lease, there were issues that we discussed that previous dissatisfaction that we were hoping was going to be included in the lease. Wasn't it like having to do with like HVAC control or
I mean, so one thing I think the general concern the board had was if in the middle of the winter the power goes out, there's no heating or cooling, and that's heating's all you care about. I don't, without you guys replacing the generator, my understanding is the generator can't survive the whole building with HVAC being on it.
To have HVAC, we would have to buy a whole nother generator.
Yeah. So I agree with you, but to my understanding is, from talking to Glenn at maintenance, there is no way to physically fix that besides investing about $2 million into a new generator.
okay, well, that's not going to happen.
But
I think you're right about that.
but my understanding is the vaccine storage is hooked up to the generator.
We
Is that right?
Yes, but we do have our one after the. I don't remember how long ago it was. Actually, it was about a year from now because it was Amish Safety Day. It was that night of Amish Safety Day. That was the night that I was here till about 2 a.m. with Glenn, and
Yeah.
it was right after that they put in a separate cooling unit that is tied in separately to the generator. So that one does run 24/7.
I mean, that's the kind of thing we'd want in the lease. But I don't know, like, I have a bunch of red lines. I don't know how we should handle those. If we should have, maybe later in the meeting, we kind of discuss the things we want to see in this agreement.
I
don't
don't
know if you
I don't know
want to
what
now.
Jim and Linda. So Linda's Applebaum being our APA, and then I forget who your APA is. Wheeler, not Wheeler. No, Laura. I'm not sure what Laura and Linda are going to do that agreement, or if they're going to throw it out and do a whole new one. I don't know. So I'm not sure how much our
So
red
you
lines.
feel like it's kind of at an infancy right now, and it's not worth
Yeah, I mean,
going back?
I'd like to, because I don't want to give our red lines to Linda necessarily, because if she's already throwing it out, she's gonna be like, I'm working off my copy, not yours.
Yeah.
So Dan, I actually just had a meeting with her yesterday, so I can call her up and just see if she's gotten it. I know I actually emailed her and asked her if she looked at it. I hadn't heard back yet, but I can see if she's gotten it yet and what she's looking at.
Okay, yeah, because I mean, there's certain just things we should include, like if there is damage to our equipment
Mm-hmm.
caused by negligence of the lessor, who pays for that, you know?
Mhm.
There's stuff like that that's just not in the agreement that I'd like to see.
Okay.
But, I mean, maybe they will do it when
Yeah.
they draft it themselves.
If anyone has red lines, you can feel free to email them to
Okay.
me individually, because you can't email them to each other. You can email them individually. I can always just give them to Linda and say, hey, before you work on this, here's some things they wanted that aren't in there. In your copy, make sure they're in there. And she can always,
Could we be copied on that?
yeah,
Just so we know what's coming?
yeah. I mean, it's all public record at that point, so I'm not picky on that one.
Do you all want to meet and discuss this in a bit more detail?
No.
Okay.
Not until we
That
actually,
was quick.
I'm interested to hear the prosecutor's take
Yeah.
to see, I agree, I don't wanna waste an effort if we don't even know their
Right.
thoughts on it yet.
Right.
We may be starting from scratch
but I think we have hit
at some point.
the high points, because I think the cost of the lease and the terms of that cost structure are the ones that are probably nearest and dearest to my heart, because we have a very tight budget.
Yep, I
And
agree.
we don't have the ability to go to the people and ask for more in a relatively easy manner, because we literally just had a levy renewal, that we chose to go for renewal as opposed to renewal and additional levy, because we wanted to maintain the savings that the taxpayers get from the fact that this was a grandfathered levy, based on the savings to the
Most of the
consumer.
rollback dollars.
Rollback dollars, right. And if we replace that, then the consumers, even though we could conceivably ask for more money, the consumers would actually be ending up paying more out of pocket for that process.
Okay.
So having made that decision, that sort of locks us into having relatively finite funds at this moment to be able to help cover unexpected expenses.
Do you have one levy or do you have one in 2
We
years?
have one levy.
We have one levy every 5 years. Lowest in the county, too. 0.2 mils.
Right. So our flexibility is limited because we either have funds that we receive from the services that we provide that we cannot make any profit on, as I was saying before, and we have the levy.
So the next time you have a chance to up it, it's 2029?
Well, we
can
can seek
I think it's 2028 is the first time we
additional
can get
levy
I don't
at
think
any
we-
time. The
right.
problem is the county just voted to allow us the levy that we asked for.
Yes.
And it's, as you know, difficult to then go back and say, hey, can you please give us more, please?
So what do we see as next steps on this? Are we waiting to hear from your APA?
Yeah, I mean,
Our
I
APA?
would like to hear from Linda, just from your fact that I feel like we'd be spinning our wheels if Dr. Henderson and I met with you, and then if Linda or Laura throws out half of this, we'd have to
Right.
meet again and start from, I think we'd be spinning our wheels. So I think if we can get Linda and Laura and Jim to at least give us a stamp of approval as it's a decent first draft, at least then we can go on that. I'll still provide any of your guys' insight over to Linda and Laura, or sorry, Linda, Laura's there, Linda, and that
Too many
way,
Lindas.
yeah, I mean, at least that way,
Yeah.
you know, she has your understanding of what you're looking at, and she can work that in versus going back a second or a third time with, you know, your recommendations after the fact.
Yeah, I mean, I think we should hold off on providing any red lines till we get some sort of feedback, so I think
That's fine.
we're
Yeah.
gonna just waste our time.
I know I emailed her when I emailed all of you on Monday. I haven't heard back yet. We met with her on Wednesday, but it sounded like they were swamped. I know Jim's preparing for a court case, so I think in general, that their office is just swamped right now, so it's probably a next week or week after situation.
Okay.
So,
Okay, if I hear something, I will let you know, but I
Yeah.
predict you will hear before I do.
I'm gonna try. We'll talk to Linda, see
Okay.
what we can get.
so at this point, we'll hold
Linda.
further discussion.
I'm sorry?
At this point, we'll hold
Just
further
hang loose.
discussion.
Yeah.
Right. I do want to thank you guys for coming and presenting what I believe in spirit, is a reasonable proposal.
Thank you.
And I
Tried
should,
to,
If we handle that unfinished space
Right.
issue,
well, as just one of
then
the
it would be
commissioners,
reasonable. I
as one of the
think.
commissioners here, I'd like to have you, you know, whoever wants to give us feedback on after the 5th year, because that's an excellent question.
Mm-hmm.
It should only go up a certain percentage for the next 3 years. Because you know, if I was sitting in your chairs right now, you'd say, okay, it's going up, 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 when's it gonna stop?
Yeah.
When is it gonna stop? When is it gonna be?
Or is it always gonna be by
Manageable.
dollar, or is it gonna
Yeah,
be, like you said,
methodology.
reassessed?
Right.
So maybe just.
So any
turn
formula
it
that you
around.
guys can give us feedback, that's wonderful. And me being one commissioner, and I used to be a realtor, it's a big difference between office space and storage.
Mhm.
And I will work on that to have it more manageable for your board.
Yeah, I mean, I don't believe we're miles apart, but just knowing what allocation, so we keep track if your utilities are going up, then we know the rent's gonna go up. If it's not, we just need to know what's being counted, how it's being distributed by square footage or by percentage of square foot. I think as long as we can have the methodology or formula, then it's pretty easy to navigate.
Okay.
It feels like 1, 2, 3 is okay, then 4, we are creeping past, and then 4th or 5th year, maybe to analyze annually with a cap on it or something like that.
And the health part is
Certainly give you feedback.
when I say fees, the fees can only take for, and most of this environmental health staff, realistically, anyone else who's on a grant or everything else, those are mostly underfunded. So that's the Board of Health, that levy would take on that expense. So when I say the fees would have to go up, that only covers those who have fee services. Those who don't would be the general fund, and that's where, like, you know, if it keeps going up, the general fund has to keep going up, because now it's accounting for more and more and more. And so those are all things you guys have to consider. I mean, obviously I have not budgeted for that in the past. It'd be something we have to work on in the future.
Sounds like Mr. Smith should apply for his license pretty soon, right?
Sooner than later.
If this rent agreement kicks in.
we good?
Yes, and
Yes.
thank you again.
Yeah.
Appreciate the open dialogue.
Okay, happy to be here. You're done, Commissioner. You've said everything you wanted to say.
I think so, unless they
Okay.
talk about another topic,
Okay.
I'm staying there for a little bit.
Okay.
We can't talk about Rotary. He'll go on forever.
Right.
Uh,
Fishing,
When's the
Commission.
drug court
Definitely
graduation?
Thursday, 4 o'clock,
Oh, like tomorrow?
yeah. I'm one of the speakers.
And also, Ken, Mr. Smith, who just recently left, the reason I ran out was I did find the video, I did find the audio. You all did say you upheld same as the minutes, you upheld Mr. Lark's thing, and that we would try to waive the lot evaluation. So he still owes $900-ish, and I'm not sure he agreed with that thing, but he did hear the audio, and he did on the audio say, yep, okay, so.
So my question for you
Okay.
is, anytime we have, you know, that type of dialogue with somebody from the public, do we follow up with them after in documented format? Like, did he receive an email or anything, just from our liability standpoint? Like, I know we have the
You
minutes,
will
but is
now.
it?
Yeah.
It might be
Yeah.
a way of doing so, just so we have it
Good for
written
clarity.
and he received it and.
Because
Yeah.
I don't think he understood the decision.
Yeah, and it's
Yeah, I mean,
unfortunate.
In the past, I would say no. I mean, usually if someone's, very rarely is it not a motion though. I mean, usually you guys are a variance
Right,
or
and that's why
non-variance.
it's- Yeah.
This was one where we just said, hey, you know,
Yeah.
your permit expired, you used even the 6 months additional, you don't have a permit. He was arguing that you should still have one. We're saying, yeah, I mean, legally, we don't have, that permit expired.
Mhm.
So,
I just think the closed loop communication would help
Yeah.
prevent that in the
No,
future.
sure.
And
And-
it's a one-off, but still.
yeah, we can always,
It's
I mean,
unfortunate.
I will say most people that, in similar situations, Dan and I end up speaking to them multiple times.
Yeah.
Because it's usually someone who needs something else, and so
Yeah.
this is probably a unique situation where he heard something very different, and then came in thinking he got it, and Dan and I tried
Yeah.
to tell him ahead of time, like, that's not what happened. He goes, no, it was. And we said, well,
It's been 9 months and I feel bad he's been living in limbo regardless of what it was
Yeah.
about, like
Yeah.
even if, you know, it was a simple misunderstanding.
Right, so, but yeah. Also, if you don't mind for the public comment section, the ever handsome Mr. Olashef is here, previous Health District Advisory Council president. He had a question for the Board of Health, which Dan and I spoke to him briefly about before here. And it's not really a motion or resolution for anyone right now. Thank you. In the code, 370701, I think is what it is, or 91, it talks about nuisance complaints and that the board can handle nuisance complaints. What it comes down to is more or less a housing code. We don't have a housing code in Geauga County. There was some discussion if the board wanted to have a housing code to enforce certain things that, and I will let Mr. Olashef speak here in a minute about more specifics, but I do want you to know, it is, I'm not saying we can or can't do it, I'm saying it is unfunded, so it's something we'd have to fund internally.
We have to be the ones to enforce this housing code?
We'd also enforce it, and then you'd have to have an actual code, because, I do understand, case by case, but case by case swings so wildly with when if the board shifts in personnel, you could have wild swings where one time it's reasonable, one time it's not reasonable. And I don't wanna get in the habit of denying one person, the next person's really close to anyway, and we accept theirs. Because then you turn into, how come my house wasn't good enough, theirs is, or my house was condemned, theirs wasn't.
Pardon my ignorance, but what is the public health piece of the housing code? Is
So
that
we have
only
the ability to
housing-
declare a public health nuisance.
Okay.
Now, the only one that I can think of that was significant in the past that Dan and I handled was a lady who was a hoarder, and they literally had to cut a hole in her house to get her out of the house. And we did condemn the house, that's because she had no running water, and I think she'd have any electricity at that point.
No electricity, that's why
No
she needs
electricity.
water.
So
Yeah.
basically, we come in when it affects the code that we abide by and the things that we
Well,
already enforce.
And we would have to set our own housing code. We don't have one right now, so we'd have to actually develop a code, set a code. Now, you could always take lakes and manipulate it, or somebody else's Stark, Summit, whoever.
Okay.
No reason to reinvent the wheel because they're all pretty similar, is my understanding. But we could do that. It's I would need funding for it. I don't know what that would cost, because if it's like everything else we do, the first couple of years it's probably going to spike when people realize we're doing it, and then it'll even out and it'll spike off and on.
Yeah, and I imagine the rollout of this and just the things we would encounter in the beginning of, not only having a housing code, but enforcing it would be
Especially the
similar
neighbor-
to like
neighbor
O and M and
disputes,
just this
yeah.
influx of things that we'd have to deal with in the beginning, which is good. We don't want nuisance
No,
complaints,
the
but-
one thing Dan and I are generally nervous about, Dan does this more than I do, but even when it happens here, that we're nervous about is we're telling people how to live in their house. That's what Dan says, and I agree, it's a perfect statement. We're telling them how to live. I'm not saying they're not in squalor. I'm saying we're then defining though, or we're setting a code that defines how they should live.
My biggest concern is, from our perspective, the environmental protection. And if they, I unfortunately, there has to be a delineation of when does APS or Adult Protective Services deal with somebody living in, for lack of a better word, squalor, versus is this person's waste running off into the neighbor's yard? Is this person, they don't have running water, electricity, and it is affecting the quality of the environment? I understand it is a public health, but when I think of public health, I think of, Geauga County entirely, and then how do the things we implement affect our population, from an individual basis up, but also down. But it gets dicey because this is almost looking at those other factors of, once that person is out of the house, is the house itself unattended affecting the environment? And if the answer is no, I'm not certain that we need to intervene. If the house is affecting the environment, yes, we intervene. But if it's just the quality of life, the protection of the person living in there, I don't know necessarily how we are going to fit into that.
Yeah, you're right, when it's affecting one person in their home, that's their life, they choose to do it, it's very, very hard for us to.
And there's other interventions that absolutely need to happen for that individual, but do health departments overall typically intervene on those things when it's, this person needs, a wellness check, they need adult protective services to come into play?
The one practical problem here, this woman that they pulled out of the house was 90?
No, she was 70, 70, 75, somewhere in there. She wasn't 18, but she was 90.
Right.
But did you
But was
guys
she able to care for
physically pull
herself?
her out?
No. We were
Right.
there when the fire department, because we had a small part in it, and then by de facto, she had no family, and she kept inviting me to court with her, and I just held her hand, and we just, I didn't provide any support from the health department, but we just more moral support at that point, just to
Well, and so
help
maybe
her.
we need a statement to say how we do come into play for these things, but I don't necessarily know how we ourselves would be responsible for the housing code entirely, because I don't think we can effectively monitor that.
There'd be other players in this, but I'll let
Yeah.
Chris. You want to maybe Chris can give some specific examples, because it's easy for me to talk broadly because you guys have to think broadly, but maybe some of his examples may help, because there are times where I would imagine it stinks quite a bit to be in his shoes, where he's trying to help. His lane ends, ours
Right.
kind of starts. But we don't have a housing code, so our lane technically doesn't start. So, but Chris, do you want to go ahead and?
Yes, please. So as a great admirer of Mr. Lickey, I vehemently
That's what I called you.
disagree with his, what he just laid out for you. And that's where I think this whole thing is at, because it's broad, vague, and in my opinion, hasn't been looked at by this department, there's gonna be a lot of room for disagreement, but right in 3707.1, all it says is the Board of Health shall abate and remove all nuisances within its jurisdiction. It goes on to state, you know, how it can be abated, whether that's by ordering the property owner or doing it yourself, certifying it to the tax duplicate. And there's other places in 3707. I didn't mean to come up with this today, it's just how it happened, and it could certainly be a process, but, you know, I don't see in here where the term housing code is not in the Ohio Revised Code. And I don't know necessarily that it needs to come from a housing code, and the reason I brought this up, Ashley, is not, like you said, to control for how people live in their own homes, by any means. Because I'm sure there's people, but if you ask any fireman or police officer,
Oh, yeah.
they're gonna tell you 15 houses off the top of their head for this.
Oh, absolutely.
My concern and the concerns I get from residents is when, you know, either the house is abandoned and dilapidated, there's open windows, and now, you know, the raccoons aren't necessarily living out in woodland environments, they're right there, and now is there bigger potential for rabies, you know, 20 feet from where your kids play rather than deep
Yeah.
in the woods, things like that.
Yes.
Standing water in basements from broken pipes or however it gets in, and that potentially creating mold or whatever other, you know, noxious odor complaints that people get. So, yeah, more to how it's affecting the neighboring properties. And this isn't gonna say that one house is gonna affect a township or a square mile, but to those people that are within a 3-4 home radius, it's a pretty big deal to them. And the way I found this, excuse me, was looking at ways that the township can deal with this
Yeah.
internally. And it's harder for the township to deal with it. The bar is set higher by the state than the authority that I think this gives to the Board of Health. So that's where it's
Yeah,
coming from.
and those are great examples because that begs the question, what is the threshold for a nuisance complaint? Because to me, like, the amount of rabies, like prophylaxis because of raccoons, like in this past month, I personally can attest to the fact that I would love to do something about that because it's ridiculous. But you bring up great points about these things that are introducing the risk of nuisance. So when do we cross that threshold?
Well,
And when, because that's when we would
Yeah,
truly
ready.
come into play.
But
the-
didn't we just last meeting pass, well, you weren't here.
No, I wasn't.
Just for food service, so.
That's-
Oh, that was
Yeah.
food service
Representing
only?
Food services, and, like,
Well, what are-
Declaring something a nuisance
what
was
is
just for
Lake-
food service.
What is
no,
Lake-
being able to stop it and shut them
Yeah,
down,
it's a
I think was what we
nuisance.
were discussing, was that not?
Does Lake have anything in
That's what
place
I was
that
gonna
helps
say,
with prevention and promotion of, you know, so things don't get that bad?
Well, Dan, I'll let Dan cover, I mean, I'm thinking housing
So
code.
the housing, I don't mean to use housing codes, because I know you said it's a bad example, but for a lot of what you're discussing, usually housing codes address those. We have nuisance programs right now that address everything outside of the house, almost solid waste, sewage, problems with wells. We have programs to address nuisance complaints with that. Once you get inside the house, typically what's throughout the state is you have it's a complaint-driven system. So where someone files a complaint with the health department, you typically even assign complaints, so that way if we have to get a search warrant, because we're usually typically legally obligated to follow up on complaints. So sometimes if we have to get a search warrant, we kind of a lot of times have to have someone who's witnessed it so we can follow up on those steps. But usually it's a complaint-driven system, and there's some standards in those rules that say, you can't have a sewage-filled basement or that kind of stuff. Safe structure, stuff like that.
And you can do
some
that
of the-
without a housing code.
Pardon me?
And you can do that without us literally having a housing code.
The housing code sets you a set of standards to go by
So it's
for
just
it.
You need definitions
So-
of.
I'm city
So that when
setbacks.
if there's a problem and we cite people, I guess I'd feel more comfortable having a set of standards that we're citing based than just saying 3701 says we have to abate nuisances and there's no definition of where that limit is.
I also,
guess.
I mean, this is one of those things also, like when we did like the cross jurisdictional agreement, the board holds all the power. I'm not sure you want, in generic things like Dan and I can set like standards and Ron can, but I don't think when it affects everybody in the community, that may not be a standard you want us interpreting on our own. like, because it'll ebb and flow, I mean, you're gonna have new people and different people. It's like,
I think it's a great idea, and I think that we are, you know, tasked with promoting wellness and a good environment in this county and prevention of things becoming a nuisance, and then also dealing with them when they happen. The part I'm concerned with is, if we enact this, we need to hold ourselves to it, and how can we effectively mobilize our troops to do so? My biggest concern is we say, yes, we're going to do this, and then we fall short again.
we'll probably need an entire person. I mean, at minimum to start with, one entire person, so you're talking, we would need funding for the equivalency of probably $80,000 to $100,000,
Yeah.
because of OPERS is set, all the fringes for us are set by
Right.
state.
Yeah, and it's a shame because it's, to me, and I agree with you, it's necessary, right? Like, I mean, there's, like, when it becomes a problem is one thing, but yeah, we should do things to keep processes in place to prevent things from getting that bad, even if there's not a human involved, right? Like, we can use APS, things like that, but what if that house is abandoned and it becomes exactly what you described, and that's the perspective that we kind of needed to say, like, well, how do we deal with that? That's my concern, is how do we essentially, you know, have the personnel and the, you know, program in place to effectively hold ourselves to doing a good job and providing a quality service.
Well, that's like, I did tell Chris when him and I talked, again, on the phone we talked earlier, I just know where the funding's gonna come from. I'm not saying we can't do something, I just don't know where.
Yeah.
Which is awful, that's the problem we have.
Yeah.
Does Lake have somebody appointed in this position currently?
Yes, yeah, we have, there's one or two that do it, one that does it normally.
Is this something we could revisit if we so decide to move forward with
I
this
mean,
as part of the cross
Yeah, this
jurisdictional?
is one big thing is the legal what we use, because they're willing to defend it, and if your legal team is not in this county, then
Yeah.
you're done, because you're gonna lose right out of the gate, so I think it starts with legal,
Yeah.
and then you have to delineate if it's indoor air quality, we don't touch it, if it smells, there's really no standard for smells causing a hazard, so if it's within those walls, it's usually no jurisdiction.
Yeah.
And if it's outside of those walls, then it's debatable, can we enter the property with fire, police, or someone else, but you can, at least you have the discussion first, I think, before you get tied up to how many staff or how many.
What Dan and I could do is I'll have, Dan and I can send out the housing code that we use in Lake for everybody. I mean, it's not that different than anybody else's, like, we don't reinvent the wheel every day. We can do that, you guys can at least let us know if anything like crazy stands out. Dan and I can use legal and go with legal and see, you know, where they're at on this, on where they feel comfortable.
But both housing code and nuisance codes?
Separate.
Well,
It's like
Both.
a nuisance
It's-
that's.
yeah,
focused
nuisance is
on-
like, nuisance is the code, or that's a
There
one of
is
the
no
parts.
nuisance code,
But yeah, it's part of that, it'd be rolled in part of it.
right, there's a housing code.
Unless it's a street gang, then Dan and I found out we can go right to that one, because street gang is specifically spelled out in the
You saw
nuisance.
paragraph 2 of that section.
Yeah. it
Wait,
is-
so, hold on.
Okay.
This must be a real problem.
It's a 2-paragraph section, such
I
as
had-
all about criminal gangs.
Yeah, Dan and I were reading the code for Chris, and I said, Dan, did you see letter B or part 2, and it says, you know, unless it's a street gang, and then you can go right to nuisance, so if it's a street gang, Dan and I'll handle that
Personally
one.
affected to put it in there.
Yeah, so,
So for my information, if tomorrow there was a complaint of a nuisance of a house with some deficiency,
So if we're saying that you call me and tell me you don't like the conditions Mrs. Jones is living in, sorry, let me just.
Mr. Jones.
So,
It's
you know,
Mr. Jones, blame him.
how would you handle that, given the fact that we don't have a defined housing code at this moment?
most likely I say we don't have jurisdiction to get in there.
Yeah.
It depends a little bit on what the complaint actually is too.
Yeah, we still got.
I mean,
with the
so
partner.
if it's really bad, we would see what we can do.
But nuisance complaints, though, you can act on, I thought.
Nuisance, we can, so outside the house,
That's a very
we,
generic term, though.
but outside and inside the house are two different
If
things.
it's truly a
Right.
nuisance complaint, though, if somebody comes in, you guys still investigate it until you deem whether or not it's a nuisance. And then if it is a nuisance,
So
then
we-
can you act on
And
something?
we have authority.
and we have
Yes,
authorities,
okay.
yeah. So outside, we're completely, we have all authority we need. Inside the house
Yeah.
right now, there's, really, it's just a kind of
Yeah,
a
no
generic
heat, water,
nuisance definition.
Yeah.
And that's where some of the stumbling blocks are, is it's just
Got it.
just a public nuisance definition.
Yeah, and there's a
So-
section of code that says if there's a program you need for public health, you can charge a fee. In this case, how are you gonna charge to support that? I mean, other than a levy, you're not gonna charge the
You're not gonna
poor
charge the
that they don't
person
have-
most
who's
likely they're
already
the
a
reason-
nuisance who can't afford to
mental
keep
health
their
issue,
house up,
and
right?
so who are you charging that
Yeah.
fee to run a?
So essentially,
Housing complaint.
the nuisance inside the house you'd actually have to be able to smell it or taste it or feel it
It had to be.
on the
done.
outside of the house in order for you to be able to have a warrant to be able to go inside the house.
In a lot-
Theoretically, because
in a lot of
smells are
times-
still dicey, because you're not really, there's no health effect from smells most times, unless there's some
This is
other
like
chemical.
gasoline.
Yeah, exactly, yeah, I mean, so, this is still slippery.
And a lot of times you even need someone that has seen it.
Okay.
And we actually had something similar where actually there was a smell coming from a property where they're supposed to be burning things. We had multiple complaints. The lady was texting me almost every day. We sent out our team multiple times. The fire department was sent out,
That's-
and they said it just sucks, but it's smoke. That's just how things work. Smoke goes places.
My question about lake, and if we have information in lakes too, is where do we get into the crosshairs of, you know, assessing and making sure, like, seeing safety, and at what point do you call for emergency medical services to assist, you know, when you go into the house, because you don't know what you're walking into, and that sort of becomes
We
dicey
don't-
for
I mean,
you
that
guys,
is-
because you're not
So
trained. in
that is
that.
one of the, I mean, honestly, I've done that program before, and it is one of the worst programs to be in, because you are going up to someone's house and you don't, I
Oh,
mean,
yeah.
I have some stories.
Good and bad.
Stuff, yeah.
Like, that's the thing.
There's some
that-
solid
that-
stories.
There's things that you just won't believe that you'll see when you
Yeah.
come into these homes. And,
Yeah, most health
Really-
districts in the state really don't have programs because of that, it's just very, very,
And that's the
very,
concern.
very loose.
yeah, and so a lot of times, you know, we tell staff, if you drive by the house and have any notion that you don't wanna go in there alone, or you need a sheriff deputy, you do that immediately. You don't, you know, we
Right.
talk about how you stay close to a door in these things, because you're going to these homes and no idea what's happening, so.
And this point gets back, like we mentioned, street gangs with the current law. It gets back to the critical element is causality, and whether we have to think this out and have a plan, whether it's a 90-year-old person, dementia, can't care for themselves, nothing else works, it's just a huge mess, or a street gang, or, you know, drugged
Mental
out
health issues, as you mentioned.
group of people. We have to, the true solution for this is understanding the cause, and for whatever that cause is, getting that taken care of.
And that prevention
And that's not gonna be
circumstance,
easy.
And I think what we can also do is, when Dan and I talk with Linda, we can always keep the less handsome Chris Olashef now after his words against me. We'll keep him in mind. We'll try to work with Chris, because Chris knows most of these inspectors, so he got probably a pretty good pulse on what is needed and what's not needed. And maybe we can try to focus a little bit better on what is a reality in Geauga versus what's not a
Yeah,
reality.
I imagine it's very different than in Lake, in just
Yeah,
terms of.
I'm sure if you look at Trumbull, Lake, Summit, Stark, everyone has their own, like, here's what we need, this stuff doesn't make any sense to us.
That's what
And
I
I-
was just gonna offer is, I could kind of flesh out some of the more common things, and I don't have anything inside the house of mine. I mean, people really aren't complaining to me about what's going on inside somebody's house. But like, what the common things to give you guys an idea of, we don't need the city of Cleveland housing code that's 3,000 pages long.
Right.
But, you know, just a couple of hot buttons that constantly come up, and, you know, the neighbors constantly call me, and I try to do my job, but, you know, it's never good for anybody, you know, in our positions to tell a resident, sorry, they're calling the government for help, and we're just telling them, there's nothing, you know, you're SOL on this one. And, so I'll keep working on that. Like I said, this is just, you know,
Well-
I'm happy to send stuff over that I come.
We'll work with Chris and try to get something reasonable to everybody, and that way you guys have an idea, and then we can always see what it looks like.
Yeah, I mean, not to be negative about this, but I think about how people reacted to our little agreement with Lake County, and I cannot imagine how the good people of Geauga County are gonna react to having a housing code. I mean, there's like a reason people live out here. We like our freedom, we like our liberty, and if you wanna live in a homeowners association, people do, and otherwise, they don't want
So
the
that-
government telling them how to live.
That's generally been Dan and I don't say, I think that's generally Dan and my concern is when we talk to people, we get that approach. And like I mentioned to Dan, I didn't mention Chris too, like when we deliver turkeys on Thanksgiving with JFS, or sorry, Department of Aging, you go to some places where you're like, I'm not sure I'd be living there. But it's usually someone who's like 85 or 90, they have no family, maybe a spouse has passed away, and it's the best they can do. I truly think it's probably the best they can do.
Yep.
I'm not saying right or wrong, but you know, Dan and I, we're about the staff safety. I'm not saying like we just think something's gonna happen, but there are multiple things we'll have to put in place to figure out how to do this. And then the reason why I want to bring it to the board, besides Mr. Ossoff asking, is when the blowback comes. I mean, Dan and I will hear it first probably, but then it's gonna come to you as well, where you're gonna have to be ready to like, did we approve this? Did we not approve this? Did we authorize that? Did we not authorize that? Because I don't wanna be out there in left field, way out on our own, making decisions that you guys are not comfortable with.
Yeah, I mean, the other thing I've seen like on the board is you have these issues where you have neighbor disputes, and then you have people that try to use the power of government in
Right,
those
to destroy.
situations. I mean, we saw, I mean, recently, with, not to name names, but, some issues where, like, the one neighbor was not violating the law, but the other person was trying to accuse them of that. And I think that housing code could be like weaponized against neighbors like that. At the very least, you're paying someone $100,000 a year to deal with that kind of crap.
We've generally, when people have asked me, like, if we're like, usually it's the Geauga Township Association meeting, someone asks there, I always tell them, like, just remember it can be used for you or against you.
That's right.
And I'm not saying we do or don't do things, 'cause I believe what Chris said, I mean, we should be there to help. I just want everybody to understand, like, when we do these things, there is a swing of the pendulum every time.
So when an issue is brought to us in the interim, is there a way that we can look at this a case-by-case basis to see what programs do we already have in place that we can either promote and prevent? And then when these become nuisance complaints, deal with them? I do agree, like, I don't care, as long as you're safe and you're not truly affecting your neighbors, I don't care how you live. And I don't want somebody to come back into my woods and say, so-and-so complained your dogs bark too loud, or so-and-so complained that you have, construction dirt in your yard and it's running off, into their driveway. I don't want somebody to come into my house for that either. So we need this threshold, and it is, yeah, I agree with you, having a code can be used or manipulated in a way that people could simply fight about it.
And I know we said housing code, I know it's not in there, it's, the reason, my concern was, I'm sure Dan's is too, and Ron's, is that if there's not a minimum threshold, is it used overly broad sometimes, underly broad other times? And I just want to make sure, however we treat the public is treated equally. Nobody should be above or below that bar. So, again, we can work something up, we can give it to you guys can say yes, you can say no, you can be indifferent. We can work on it. The case by case, like I mentioned to Chris, is just tough because it could change with how the board approaches things, and then we could have significant swings in how we approach things. And I get nervous that one person's told yes in 2024, one person's told no in 2028, and it's a close enough instance that you'd be like, why was one yes and one was no? And it's just because that's how the board decided things.
Yeah, the other thing I think I have a concern about is just redundancy in government services, and to extent, adult protective services can be handling things, townships should be handling things. I don't think the health department should be getting involved.
Yeah, I mean, we will gladly work with whatever you guys want us to do. I think, Chris brought up a valid point. We've had this conversation actually multiple times where he needed help or somebody else needed help, and we always, without a code, we're somewhat lenient, or we're somewhat a little bit adverse to jumping in. We don't have something that backs why we're jumping in, besides the generic code, which I understand the code is there. Without requirements, though, it's a loaded gun that whoever's enforcing is to point at somebody, and that's what I'm always nervous about.
As we move ahead, what we do that community health assessment, which is a good time to bring up these kind of topics, because while partners at the table, so keep in mind, whatever's decided, it's so it'll hit police, fire, mental health, all those other groups, without them at the table.
When's that done, Ron?
We'll be starting probably in a month or so.
Oh, nice.
I mean, I wonder if we should hold this conversation off, and that's a topic of conversation.
We can bring it up.
Yeah, it has to be an interdisciplinary group that handles these things, but it does need addressed, because.
Oops, sorry, guys.
No, that was.
In an effort not to hear that whole lot longer, Chris, do you have anything else that you'd like to add in?
No, I could get it to
We'll work,
you.
yeah. Dan, I'll work with you
I
to
just
see what we
wanted
can get to.
bring this up.
And Geauga does have an increasing elderly population, and of the group, that's probably the saddest situation. The 95-year-old that no family, no neighbors, and they're doing the best they can.
And they've got nowhere to go, so they're oftentimes in houses and properties that are way too big to handle.
Yeah, and the only time we find out is when something bad happens, unfortunately.
Yeah.
We just,
Everybody's doing the best they can. It's just everybody's best is different.
Right.
So, all right, Chris, we'll work with you and we'll talk.
So at this point, should we go into the reports, or?
Sorry, Dan.
You have one more member of the public in the back right there.
Oh,
I don't know if you wanted to speak or just watch.
Really?
Yeah.
Oh, that guy.
I have comments, but I'll save them for this evening.
I was going to, the rest of the public.
Oh, I'm sorry.
The shady one knows
Yeah.
Brady.
I haven't had to make a
Didn't we
public
have a
comment
bouncer?
since.
That's Mr. Troublemaker here.
21?
Juan, was it?
Yeah, it was 21, September or August, whatever it was.
So I'm capable, but I haven't had.
Yeah, all right.
And we,
He has some questions about monkeypox he'd like to bring.
Item 2 of 25, we have next.
we'll do the rest of the public comment at the end if everybody's okay with that. Just, I want to get the ones who are going to be here specifically to talk about topics out of the way, just to say the whole thing. I know Mr. Work with you as well, so that's what I'm here. Board Rotary business. All right.
Health district reports?
Yes.
So at this point, we'll move on to the health district staff report, starting with population health.
No update other than what's in the report. If anybody has any questions on that one, thank you, sir.
Then the environmental health report.
Dan.
Nothing to add.
Nothing.
It's been an hour of adding things.
The administrator's report.
No additional comments except for, we'll come back to Mr. Graham when he comes back and get around for a second. Just because I do want him to cover accreditation and one other thing that he's been working on. Because those are costs that we'd have an idea where you guys are going. The other thing that I think Mr. Graham will talk about is in terms of accreditation and those costs, where do you guys want to go with that? And so that'll be a discussion that we'll have to have as to where you want to go. Because there has to be funding for it, like everything else in life. And I just have to know where you guys want to go so I know what the budget and know what to prepare for. So if we want to jump past that, we can come back to Ron when he comes back
Then
in.
the health commissioner's report.
We'll jump that and come back.
Are we gonna talk about finances, or are we gonna go back to that before we approve?
We can talk about finances now if you want.
Yeah.
I don't mind.
I do.
We're waiting for Ron.
I do. So where are we with the, outside legal services? Looks like there were 3 invoices paid. How many
Yes.
months was that for?
Those were, I think it was for the past 2 months, if I remember correctly. Most of that was used for the records retention schedule. That was complete. I actually got the record retention schedule back today, and it was
Okay.
approved. So our new record retention schedule is in place. My hope, keeping with record retention schedule statements, is that I would like to digitalize everything in the basement.
Yeah.
There are thousands and thousands of files down there. I have no idea what that cost would be. Like, off the top of my head, I just don't know, because of how much piece of paper there are. Because we could decide to limit the space we have downstairs if we ever needed to, but also, paper copies are only good for so long, and you start losing what's actually on them because, they're only good for so long.
What's, the email retention for in the record?
Email retention is based on the subject. So if it's about payroll, payroll is a forever thing, you keep it forever.
Okay.
So it's based on
I'm
the
asking
subject.
for our email and for
Yes.
Ms. Roman's email account.
Yeah, so-
when she can trash it.
What we have done recently, what we have done recently, and I started with Melissa, is that we take all of what we do is I'm going to issue guys emails from now on, and so we then have that email, and so does Mr. Kostura, and then he maintains that with.
Oh, interesting.
He's not like going in there every day, but if we ever need a record, we have that.
Yeah, that's a good idea.
And so I got Mrs. Romans back from her. We now have that. And then Melissa's I set up specifically separate as a Gmail. So it's just record retention. And I will say for the most part, for anyone listening, there's not much emails going back and forth. It's me usually us sending you guys the board packet
Yeah.
and the occasional thank you. So
Yeah.
there's not a bunch of juicy stuff in these things. It's just generic stuff. But when they ask us
Don't
what's
get ideas
in there,
for public records.
Right,
People watching
yeah.
this YouTube.
but because I'm sure somebody's gonna say, "Oh my gosh!" When they ask what did, let's say, Melissa send to XYZ, she's got to go in and look. Versus now we can just say, beep boop boop. There's nothing there, and it's that simple. I'm not bothering you guys. That's my technical beep boop boop.
Yeah.
It's very
Yeah.
high.
That's
Yeah.
everything works so
You can because we have it. You can just log out of it because we have the
Yeah, look at
access.
that.
Yeah, don't delete it. Don't delete it. Just log out.
Here to here then.
Yeah.
Just take that
So
off my list.
that moving forward, though, every new board member will have one I set up, and Mr. Kostura will have the password as well as the board member, and that way. And the thought for Mr. Kostura having it was, if something happens to me or something happens to him, there's still one other person that has that email password. It's not like a lost in space type of a thing.
No, that's a great idea.
So
And that is a good idea, because I had to sit with Brian and go through
Multiple
emails
times.
that he didn't understand.
Yeah.
Really.
so we're trying to amplify that and make it long term a more viable solution.
I'd like to go back to your point about being perhaps able to get rid of having to retain the files in the basement.
Yes. So
Yeah.
there's thousands of documents. And those are the ones that I stayed here for many hours. And so was Mr. Lark going in with Mr. Kostura's team when we did the House Bill 110.
Yeah.
Some of them were in the wrong file, some were in the wrong area. Idealistically, there's a company that does this. They scan it. We actually use them now. We get them scan it. It's a penny a page or half penny a page. I forget what it comes out to. I just don't off the top of my head.
Right.
We could have them scan it. It's gonna have. There's an expense with that, obviously,
Right.
and we'd have to say yes. We want to get a quote. Yes, we want them to do it.
Right.
I think it's the right decision.
Yeah.
Yeah.
There's everything I have brought you guys today has been like, by the way, there's a cost, and by the way, I don't have a budget for it. By the
That cost
way,
is less than what's the space we're gonna be renting
Exactly.
for years
Yes.
to come. It's a one-time
So,
cost.
I think there's two things to go with that.
Great
One is the space is probably more expensive long term because you're talking into
Yeah.
perpetuity.
Yes.
The other reality is Lake, as an example, when they had their fire, we lost all those records because there was no way to. Once they're burned, you can't recover them.
And are you really going down there anytime you need to like look up something, you're gonna just start digging through those?
So
That is not an effective use of
some
money.
yes, but some are already in that server and they can go get them right now.
I mean,
But
it's just-
it is a pain to go down there because, I know when I'm down there, you gotta roll the thing out. You go find the one you want. You don't roll it back. Somebody else has to. Is the file on the very top shelf, where Dan and I've probably put half of them because they need somewhere to go. Someone who's 5'5" is not getting that file down, which means one of us has to go down and get the file down for them. And some of these boxes, most of them are packed full of them, so they're a solid 30, 40 pounds.
Right.
So it's not.
It's not like you can just go in and.
No,
pick
you're-
whatever you
it's
want.
not
That's my
super
point, is
simple.
This is not a productive use of anybody's time.
It is not. So I would,
There was a lot of expense in moving all those.
Yeah, you
There
gotta
was
have
very
a
large
hard
expense.
copy
So-
as
Just in
needed.
case we have to move
By
again.
exception.
And lastly, are you aware of any file, any piece of paper that either state or federal guidelines require that we actually keep the paper copy of
Well, that
it?
would be the record retention
Yeah.
policy.
Yeah.
that we
Yeah.
want to
Should-
follow.
yeah,
should
our
be
retention
definitely
file
taken
addresses that.
Okay.
On average, the only thing we have to keep, which is, I would say is subjective, is that a year of, whatever the audit period is, many of them want the paper copy.
Right.
My argument is, what if I created it as a PDF and I print it anyways?
Yeah.
Why couldn't I just print it?
Yeah.
And usually that's held, even Lake, that's held where we just say, I can go print it off for you, here it is. Like, I don't understand why you'd actually, like, I don't know,
Yeah,
just need
original.
a manual copy.
Yeah.
So, yeah, there shouldn't be anything that would stand in the way of that I'm aware of.
Okay.
Okay.
Yeah. Back to Ms. Berkey for additional questions.
Yes, I do have an additional question. It is regarding the public health accreditation fee of
Ugh.
$5,600.
I'm glad Mr. Graham walked back in, because this is
Yeah.
part of our
Those guys
discussion.
are delinquent.
Where, what page is that?
That's under.
It was like the 6,000 something, wasn't it?
Yeah, 5,600.
Yeah, so actually I had it in my notes to bring up and I forgot I didn't have a USDC, not whatever.
It's on, it is in there.
But, so initial accreditation, during the time I was $14,000 down payment for the initial accreditation process that you were to commit to. It included training at the time. We take somebody to Virginia for 2 days and jacked up that price. And then it's $5,600 a year for the next 4 years based
Who
on
does that
your.
go
It's for maintenance?
That goes to the Public Health Accreditation Board.
This is a scam.
It's someone to with that.
And and this is just what most health departments use this board? Is it a requirement that
we
you
have
use
to.
this
It's a
board?
state, it's a state
law.
mandated that you become accredited.
By this board though, I'm saying, or can you use any accrediting body?
No.
It's gotta be this board,
gotta be-
oh, that's
one of
ridiculous,
the-
so that's
It's a scam.
the third
So it's
question.
roughly what, I can't read my notes, I have my bill in here, but I forgot to bring the flash drive. It's like $28,000 for the first 5-year cycle. The second cycle will be about $6,000 cheaper. It'll be that'll come up in 26.
Mhm.
Annual report was completed in 22. I completed in 2023. Surprisingly, they let it slide as a health district with all the stuff we had going on. They were very sympathetic. The report is now due for 2024. It's due in September 30th, so we'll be working on that. That's probably 20 pages of stuff we have to justify how we have progressed since the last report. So the building, the rent, lawsuits, lack of a coordinator, all those things I gotta get past and try to wiggle past and have confidence that as a partnering agency in Lake County, we are accredited and we're gonna skim through as much as we can.
So our accreditation is still separate for Java
Yes,
and Lake, so
yeah.
we don't share a cost or anything, we both pay
No,
the full.
we are
Tried
in
to
theory
work
right
that,
now, yeah, we're kind of.
and we're not getting a whole lot of,
So we're kind of bluffing through the process to fight, so in 2 years, can I get that done? That's really the goal.
Okay,
The health assessment typically is every 3 years. That was a tune of $65,000 split between the health district and the hospital.
We pay about half.
That's
I wanna
coming
say.
up now, so, we are contracting with UH on a beta process for data. Conduent was one that was used, last year in 2022, when they did that. We'll complete ours in 25 for publication in 26 for the hospitals, but nonetheless, they're moving ahead this year. That data project was about $70,000 that we upstart. Hopefully they'll save us $700,000 over the next 10 years, collectively, if not influence the state.
And the last time we did the surveys and everything else we have to do for that, I had 2 in-house staff. That's pretty much all they did with me a ton of the time.
Yeah.
And we don't have that luxury any longer. So these are all costs I mentioned earlier. These are all going to be stacking everything else we have.
Yeah. So roughly, it's about, over the 10-year average, looking at the health assessments, the staffing component, if you had a full-time educator, it's about $100,000 a year you put into that. The state gives you about $20,000 for your state subsidy, because you're credited from 19 cents to 38 cents or something like that. 1 year we applied on Bob's behalf for the health assessment. We got it paid for by the state. That was like, I think 2016-ish or so. And so this year I just met with the UH. We're trying to get it to use internal contractors. We have some staff. We can probably, in a contractor, we can pay $5,000. We have to convince UH to give up their trusted partner at some level, not to do all the data analysis. So we're working on that. So we hope to get the $35,000 price tag that normally will come up for you is down as low as we can.
And if we go on our own, we front all of that cost.
Yeah.
We partner with them because the hospitals do every 3 years. We do every 5, if I remember correctly, but we do it on their 3-year schedule.
Yeah, we require because the state mandate to go 3 years. So it's dicey at best. I'll send out more information on that, but I mean, I think we're in a good spot for 2 years. Problem is, like I said, for 5 years, so we have some wiggle room on our side of the assessment.
Okay.
You guys are running out of less because you'll be back at 26 to be reaccredited. You'll be based on this fidelity model of health assessment, which we're trying to change. And there's some wiggle room, but it's.
So what's the maximum years you can have for accreditation?
5.
5 is the
Yeah.
maximum, okay.
So we're in year 3, which means
Okay.
when you look at the health assessment, this won't be judged to determine your future.
Okay.
And the year we are pressed financially, so we're trying to come back with that,
It's
but also
very
down
expensive.
the
It's very
details of
expensive.
that, yeah.
So is accreditation, is that an ORC requirement?
Yes.
It's ORC. And how
I
long
believe
has
it
that
is.
been around for?
15?
15
No.
years?
Like 2015,
I'm trying to think, like 16.
15
Or, sorry, we got accredited, it's
Yeah,
2007.
I think we had to be, apply for accreditation by 2014. I'm trying to go back and
Yeah,
remember.
because we got it in
But I'll
14.
get the history
so
of
it's-
that, put it out.
Yeah, it was before that.
Who are the forces behind that legislation?
So.
Other than this accreditation
So
society.
part of it was, that was a move by Robert Wood Johnson, CDC, National Institute of Health, all the big players, American Public Health Association. Unfortunately, in Ohio, the Association of Health Commissioners conducted a study, was meant to look at the money we would need to operate ideally. When that report came out, it basically said that most health districts, and the number it put out was 100,000 population or less, were not scaled enough, efficient enough, or had the capacity to do that. You should close your doors. Well, nobody liked that when, top 12 health districts are kind of up in our area, the rest is very small. So they fought that. When they got in the hands of legislation, they proved their own case, that you guys are not efficient, figure it out. And then it just kind of went sideways for many years. Geauga certainly was against it, and everybody had to get there, but they threatened to take all your programs away. Originally-
The state threatened to do
Yeah,
that?
if you didn't hit the window, you would lose all your programs. So you'd have nuisance complaints, that's about it. They could take EH, the septic systems, the food programs. So we started aligning ourselves like, who wants to take a sinking ship? So if you're getting kicked out of accreditation and the state's gonna mandate another county takes over, why don't we do it collaboratively? And that's really, we started with Adam and I we reached out to the board and Bob and say, how can we do this together? Either umbrella the partnership or make it more cost effective. And then between COVID and all the other changes, it's kind of in limbo right now. But I'm confident we can have a good business strategy to get around it. It's just
Well,
something-
what's the advantage of accreditation? I know we were told that we could apply for some grants otherwise that we couldn't if we were unaccredited, but I mean, other than just complying with the law.
That was
there's
veiled threats that have not been backed up. And based on an O&M call we had yesterday, Adam and I, and some other things, there's still just a lot of non-commitment by the state and.
From a financial standpoint, I can't stand accreditation because it's a giant money pit that, you know, and I don't say this like, I have personal opinions on accreditation, but when I talk to Dan, who oversees the largest department in both health departments,
Yeah.
you know, what are you doing better than what you did
Right,
before?
right.
There's not much we're doing better, we may document it more.
Yeah.
It's not a better service to the public, and if we spent
It
that
just costs
$100,000 on the public, I could have a housing code inspector, could have another sanitarian.
You're not selling GI gun.
Well, yeah, I get another set, you know, another sanitarian, another clerk, we'd be, you know, being more efficient in other models.
So here's a wild idea. Board of Health members, what if we wrote a letter that went to our 2 state reps and our state senator? And, I mean, when I say we write, I mean like Dan and Ron and Adam write a letter that we sign, talking about,
I'm already a black sheep.
you know, talking about the difficulties that, you know, health departments are facing financially, the increased cost of doing this accreditation program, and how there's really no benefit to the residents.
Yeah, we brought that up on the AOHC call, and I was like, kind of lambasted that 15 years of accreditation is not enough time to prove that it works.
15 years is not enough time to prove it.
Well, I mean, it's gonna cost how many $1
Work,
million
but just
to
don't-
taxpayers?
Melissa, the magic
You know?
number is next time. It's just
Yeah.
always,
Next 5-year cycle.
and I think, so Ryan, I looked up, I don't know why I said 20, because we were accredited in 2014.
Some-
2011,
Shouldn't have
2011 is
accredited
what it
us for
says was when they mandated it in Ohio.
Which one year?
2011, they said it
2011.
mandated.
Okay, I think, yeah.
So something like that.
I'll go back, because I actually had some notes on that I was gonna go through, but in lieu of time, it's, you know, pretty confusing. I'll do kind of a 2-page white paper on it, bring you guys up to speed, and then.
The frustration I think a lot of us have is that money can be used for the public. Instead of going to a faceless board, my opinion, a faceless board that,
Right.
and for like, again, if there was a better service, I'm all for it. Like, if we're better serving the public, if there's things that we weren't doing, that's fine.
Well, that's what I'm
Yeah,
saying.
it's
I
supposed to
think we
come
should
full
get it,
circle.
I think we should get it on our legislators' radar.
Yeah.
And, you know, you guys don't have to sign it, you can help us write it, but
We'll sign it.
we, the board members.
They already know
can
me
sign
and
it.
Ron talk about this anyways at meetings.
They know.
They know how you feel.
Yeah, we did
Yeah.
we made some exceptions when it came up to the deadline that you could assess to yourself for readiness. So they backed up once already. I don't think anybody's lost any programs, so I feel confident that we could also kind of be in those gray spaces for a while until we can convince them that there's way to umbrella agencies together
And we were told there was gonna be more grants, there was gonna be more funding. So
Yeah.
far, that has not happened, and every time we talk to them, besides the 25,000, now, that's nothing, the 25,000 everyone gets, there wasn't like this big carrot when the stick, you know, 'cause the stick's been hitting you all day long, finally get to the carrot, and the carrot's, you know, like that big, it's like, well, I did all this work, and I'm not even getting a snack, like, this is not gonna get us ananywhere.
So the health assessment is a $60,000 to $80,000
I'm
project.
trying.
We know
They're-
for
they're
3-year-old
poor.
data that's self-reported, you know, so our system will be using hospital data real time, do it on a weekly basis if we want to, and no additional manpower costs per se it's gonna run. And it should save, you know, $60,000 per county over 113 counties if we get the methodology moved out to everybody in hospitals to play the game. UH has been phenomenal. We are so much further than anybody probably in the nation on sharing data. And once we do, hopefully that'll break into some larger 5-year funding grants and then take that money and reinvest it to service delivery. Even the accreditation coordinator, I don't mind because it can be public health, but a lot of the other stuff is just, especially the data side is exponentially not beneficial, not timely, and expensive, so.
I just want to make sure you guys are aware of this, because obviously these expenses are all going to be mounting, and then with rent on the horizon as well.
Right.
These are all things that, I mean, it's got to come from somewhere, and as that cash reserve, that cash carryover draws down, I don't want you to think like it's going nowhere. I mean, it's just, these are expenses that are consistently occurring.
I agree that letter or no letter, we need to proceed in the direction that you're proceeding.
Yeah, thank you. Yeah, and hopefully we negotiate the contract and the data stuff down to 20 instead of 60, and they take all or most of the cost on it. And we pay a little bit in-house to do it, so.
And we don't know where UH is going to be this time, because UH just cut 300 people. They're cutting more next year. I mean, this is not, it's not like they're flush with cash and they're like, hey, you know, we'll help you. Because there's another project we were just over there with not even 2 weeks ago, and they've said there's no funding for it at all, and it was supposed to be like a done deal. So, I mean, those are all things that we have to see when we get to the table, what actually happens and what comes of it. So, anywho,
Yay.
yeah.
And better news.
Yeah.
That's all I had. I wanted to focus on that because it's quite a lump of money there.
on the front of the UH sign, it says there's a new chief operating officer. Is
Yes.
this part of that?
Yeah.
I actually met him because I didn't realize they replaced their CEO or CFO, sorry, CFO. And then I said, yeah, I'm here to meet him. Someone's like, he's not here anymore. I was like, oh. I said, I didn't know that. I just met him like a week
We
ago.
got more wires in the fire, trying to see what pans out,
Yeah.
snag something.
Do we need to circle back to the financial reports, because we
Yeah.
kinda,
Yeah, that's new business, I think.
Yeah, well, were there any more questions, I guess is the thing. Was there any more questions we had?
no, that was my question, was about the
Okay.
accreditation cost.
And you will see in, Dr. Hendrickson did sign off on the January through June bills of Lake's contract. So there's a significant amount going out for that. It's just been trying to lock down signatures and stuff to get all that stuff signed, so that is going out as well. But anyways, on to old business, which I think we just did, or already done, and then on to new business.
Motion to approve the financial reports.
Do we have a motion?
I just made one.
Yeah, we need a second.
Second? And vote?
We can do, yeah, we can just do all ayes and nays.
Y-
All those in
yes.
favor?
Aye.
All those
Yes,
opposed? Abstentions? None heard? Motion carried.
We're still alive, we're
Yep.
operating.
I know you're looking for yours. Permission to approve appropriations for increases and decreases. And, sorry, I gotta get that out for you here.
We're in 6, correct?
Yeah. Here, you need
Oh,
my-
60102.
you need my copy. There's that.
And we need a motion again?
Yep.
What are these?
I'm gonna pass this down. So this is just a transfer in of $35,000 from the injury prevention fund to the general fund, and that's just reimbursing expenses the general fund already incurred. And then we also have increasing Fund 6003 salaries and other miscellaneous lines for we have with some of the sewer projects like that with O&M. There's that one, and then we also have Fund 603, which again has to do with O&M, and that is again increasing salaries. We are decreasing other though, so it's easier net effect on this. Or sorry, we're increasing other and decreasing salary lines. Sorry, wrong way around. I'll let you guys pass those down first. There's also a sign-in sheet that's going down too. Yeah, all right, sorry.
This is the
Thank you,
down
sir.
now.
So what is it you're asking for a motion for?
This is the motion for the increases and decreases. Those are the ones that you have, I think you have all of them in front of you now.
That's the 60102.
Yes. Yeah, Dr. Root has all three of them right now.
Right, so I move to approve permission to approve appropriations for increase, decrease.
A second?
All right. All those in favor?
Aye.
All those opposed? Abstentions? None heard? Motion carried.
Do we need a vote on 03?
Yes, we have the
And-
purchase, they're done now.
03?
Yes.
Can we have a motion for resolution 2349, then and now purchase order for Chicago County Water Resources not to exceed 13,885?
And these are just for, at the time, we didn't have a purchase order open for the water lab, so these are fees for the water lab. This should be the water lab.
Is this for the samples for the system testing?
There could be more than that, but these should all be they should all be samples, yes.
Can I vote on it? Do you want me to?
You can abstain if you
I'm
want.
just gonna abstain.
Yeah.
I move to approve resolution 2024-9, then and now purchase order to Geauga County Water Resources not to exceed $13,885.
Second.
Second. All those in
Or-
favor?
Yes,
Aye.
aye.
Abstentions?
Abstain.
Mr. Jones abstains. And then anyone opposed? None heard. Let's pass that down. With those increases and decreases, we are still holding to the budget that we have allotment for. So these are not like insane increases or decreases. We're leveling everything out. Most of these are going to operation and maintenance because obviously we have the additional sanitarian and we have the additional supervisor, half a supervisor. Just rolling all that out. That's where a lot of that goes to, which is what you'd expect for what it is.
So the first reading is next?
Yeah, so now we have the first reading of the food fees. Dan actually just finished these up, the food fees
yeah.
adjustments. And so these are just bringing them into alignment with what we have to. I'll let Dan.
Just on a yearly basis, we're required to go back, use our salary data and expense data, put into a big state spreadsheet, and it kind of spits out our maximum numbers. So based on the cost from last year, it actually is a reduction in cost for all the businesses in the county.
Right, it looks like they all went down.
Yep.
Yes.
Yeah.
Except for vending, I think.
Vending was one, because that last year, well, that one's been, it was misdone for how many,
Yeah, so.
how it was done was
The
incorrect.
licensing for years and years here had been done inappropriately for vending.
But it went
they
up
have been-
18 cents, so we're not talking
Yeah.
about.
We can only do the
You-
CPI.
Yeah, it can only go by the CPI. So
Literally.
that program will never break even.
We don't sweat too much, there's not a lot of
Some
money.
of them stayed the same.
And the food fees, we always lose money on those because you're a year behind on how you calculate it. So this is data from last year, we're using to get fees this year, and then we'll do this year's data next year. So,
So if you're too efficient, you lose money.
yes. And so when you talk about rent as well, rent will be another whole year behind. So this is just one more thing that's just gonna be behind and behind and behind. Yeah. It's how our government works in this aspect, it makes no sense. So that was that one.
And we don't need a motion or anything on that.
We do.
Yeah, you'll
We
need,
do.
you have the, yeah,
We do have a
Great.
public hearing coming up for the food fees, we do have that.
yeah,
I think, I wanna say September 9th, off the top of my head, I think is scheduled for that, so.
yeah.
We have a public hearing, so we get comments from all that, we send out notifications to everybody who's impacted by fees. We'll have a public hearing actually in this room, and you're more than welcome to attend, or we'll pass on any comments. I will say that typically nobody shows up for that.
I was gonna ask
Yeah.
who shows up, or do you just eat a box of cookies by yourself?
Yeah.
So can we have a motion for resolution 6.02, resolution to increase certain fees, food service programs, first reading?
So moved.
Second.
All those in favor?
Aye.
All those opposed? Abstentions? None heard? All right. And besides public comments, the O&M is still rolling out accordingly. We are just working through that. We did send over the first delinquencies, or we're about to send over the delinquencies to the auditor's office. They will assess those on taxes. We update with them. We're at the prosecutor's office on how to handle some other items that are coming up. So that's all still rolling out pretty well.
What sort of percentage are you getting as far as compliance?
I forget what that was for NPDS.
We're really close to about 70%. I can't remember which side of it, but we're up around 70%.
Which is not that far off what we expected. I think we expected 70-30 or 60-40. So we were pretty
That's higher
close.
than I was expecting, to be honest.
Yeah,
Mhm.
yeah, it's, yeah, I don't, we're happy with being in, I mean, I'd love to be higher, but
We're- Yeah.
70% for the first round, going
Yeah,
up, go around is
baseline.
really
Pretty
nice.
respectable.
Yeah.
We do kill them with mailings, I mean,
Yeah.
I don't know, and we send out postcards, letters, and try to put
It's a
bright
lot.
fluorescent stickers on stuff, so they draw their attention in the mail and stuff. It's been-
Yeah, for those that wanna be able to be led to it, they know it, they wanna fight it, you're not gonna fix it, but at least if you help remind them, it helps with that general non-compliance.
And I did speak with State Rep Sarah Fowler, and then I've also talked with Demetrios as well about this, because I know there's some questions about funding, what happens when we don't have things. We are working on that. We're also working on an internal funding source. So theoretically, this is not approved yet. We're still going through legal with this. If it costs $100,000 to run that program, which is a random number, and we bring in $120,000, taking that $20,000 and putting it towards a fund that helps those who are lower income or unable to maintain their system themselves due to income levels, that money would go to them instead of just sitting in a stockpile in a fund for 100 years. For those that do or don't remember, back in 2016, 17, when the for sale property program was operating, there was a lot of money setting aside in two different funds, and they tried to transfer that money to the general fund, which is a golden rule you don't do, because then you can use it for anything you want in essence. The restrictions are taken off of it. I actually worked to stop that from going into there. But that $2 million that was sitting there was just money that had been collected over the expenses for years. And so we don't want to do that with this. We'd rather use that money for the betterment of the public versus it just sitting there. So we are working with legal on how to do that if possible.
I would be interested to see, how do we use WPCLF with that and?
We can.
supplement?
Very similar.
Okay.
Yeah.
Yeah.
Okay, cool.
Yeah, so this would be for lack of better words, what Dan, at least I was calling it, I think Dan was, it's like our own version of like WPCLF.
Yeah.
And we talked, prosecutor's office, both Lake and GL, and we said, hey, we would model it exactly after. The income mill is maybe higher, so it's not so restrictive, but it would be a mirror image of that with local dollars.
Most recent is the Ohio Department of Health yesterday, was it Ohio Health? Or
Yeah, we talked to him yesterday.
And I can't remember, and it was, a great idea, but we're not gonna give you much verification or validation that you can do that, but.
We won't lose WPCLF though
No.
by having this if we're not using
No.
those dollars.
We would
It's
not.
a competitive process for the.
Okay.
Yeah.
Okay.
It would just help our less fortunate members of the population. Because the reality is, whether people like it or not, just because you have less income, your waste still affects the rest of us. And so it is protecting the community in general. And it's, I think it's a good use of government dollar or tax dollars. It's not the bad use of it.
That's really cool.
So, other than that, we can do public comment if there's no additional.
One other quick question. Of that 30% that wasn't compliant, do we get anyone to change their minds or haven't approached that yet?
I mean, I look at the tax bill.
It's on their taxes.
Honestly, we still try to, we still knock on their door and try to sample their system. Because it's a requirement and mainly we wanna make sure they're working.
Right.
So, so we still make an effort, we go knock on their door and say, hey, we're here to sample your system. And if they don't allow us, we leave, and if we do, we go get it, and
But in
or if
general,
they're not home, we'll leave
has
it
this
door
second
hangers.
go around been successful or nowhere or?
We're
Hard to say.
It's hard to say yet.
Yeah,
so.
okay. All right. So at this point, citizens' remarks?
Yep.
And just a few points, the session will last 20 minutes, unless the board moves to extend, 2 minutes per speaker to make comments, ask questions. The board will answer questions after having the opportunity to investigate responses following the meeting. This is not a press conference where answers should be expected on the spot, and the board responses were recorded and publicly filed with the meeting minutes. Any?
From left to right, the shady gentleman in the back that Mr. Larkin was concerned about. Would you like to speak?
I will not.
Oh, all right. I gotta restart my timer.
Nervous.
Yeah, that's right. I can feel it all the way over here.
Mrs. Roman?
Nothing.
No. The lovely couple on their date night again? No.
Keep them magic alive.
Vicky?
Thank you.
You gonna break the streak here?
Well, oh, yes.
All right.
You know me.
I know. I mean, I figured.
So I wasn't at the last meeting, but I listened online, and I listened online before I came here tonight, so it's a little difficult to hear. So in regards to the rent, so last meeting, weren't some of you supposed to meet with them to figure some things out?
Yeah, so,
Did that happen?
Dr. Henderson and I were supposed to. I asked for a meeting. We did not hear back about the meeting. And then I got a notice of the draft lease on Monday Monday afternoon, early morning, 1 or 2. And I said that to the board, and then they could meet that Thursday, Friday, meaning this Thursday or Friday.
We were planning on meeting
Yeah.
this Thursday or Friday, and then,
Tomorrow?
Tomorrow,
Yes.
but by the time we got that back to us, my schedule was full, and so therefore it'll be next week.
Yeah.
But
Next week.
ironically, as I mentioned to Dr. Henderson, given that the board just got this for a matter of a day and a half, it makes no sense for him and I to meet because the prosecutor hasn't approved it, and my concern is I'm talking about a document that has no legal approval, and we can't do that legal approval. So I feel like it'd be futility of me just sitting there wasting your guys' time and money to talk about a contract that doesn't have backing yet. So
Yeah, so I'm just gonna put out there, because you guys are all really nice, and you didn't say anything, but they're shooting off their hips. They're not listening to what you say. They can go back and watch the videos, and they can certainly figure out what you've asked them to do in the past. They were like, oh, the board meeting is Wednesday, we gotta do something, okay? So I don't trust them, and you shouldn't either. And, if they're gonna shoot from the hip, what else are they gonna be changing along the line and in the 15-year contract or whatever it is they want. Was it really 15 years? Is that what I heard?
5 years, I think.
5 years. Oh, okay, so they were
15
just
was the
gonna
other
go up
thing.
by $1 for 15 years or something? I don't know.
That's what we're
Well,
trying to
those
do.
were the questions we
potential.
asked.
Yeah, okay.
Interpreted
Because
it,
I
right.
couldn't hear a lot of what they were saying.
Well, today, I wasn't at the last meeting either, but
Yeah.
they were here earlier today as well, and we were able to
Right,
ask a lot
and
of those
so,
same
I mean,
questions.
let's just say what it is. I mean, they're just not putting the effort into it. And did she just not say that they took another contract and just tweaked it a little bit for you guys?
Yes.
I mean, come on.
Yeah, it's not simple, we just write up what we want and then we send it back the other way. At this
Yeah, I
point, you
mean,
know.
are your
We'll
red
throw it
flags
and see
not
what
going
sticks.
up? I mean, they should be, so.
Yeah, I mean,
That's all I
the
have to
contract
say.
they sent, I mean, you know, I'm not a real estate attorney, but it's definitely drafted very much in favor of the landlord. Like, there's certain language that should be bilateral, that's not bilateral.
Right.
So,
And they actually have contracts with other people using that?
Well,
apparently.
the concern I have that
Yeah,
I
it's
mentioned to the
the
board before is it's an unknown cost. So I can't control the cost, and if year 6 they decide it goes up $4, now if we put a cap on it, I'd be much more amenable to that.
Yeah.
Yeah.
These are things that, you know,
Right.
when you start talking, we'll never own the space. So 30 years from now,
We're losing
I don't know
money.
where we're at. I
We're just
mean,
losing
it's,
money by doing this.
yeah,
Maybe
that's my
we ought to
concern.
look elsewhere again. I don't know.
Yeah.
It's all on the
Along
table.
those
I'm just
lines,
saying.
along those lines and with a sense of humor, I'm anticipating our next option will be moving the whole department to the basement. And if not that, moving,
Yeah.
moving,
And the story
We'll see what we get.
He asked
See what
for
we get,
Two-
guys. Don't get
two-
too excited.
2 seconds, and then the next option would be moving to Michigan.
I think you guys gotta remember though, when they first came, they were looking at 8 something an hour.
Yeah.
Yeah.
No,
I mean,
it's-
a square foot.
Yeah.
It's
Yeah.
moving so
Oh,
many
It's
how
directions.
generous. Oh,
And-
sorry. But it should
But-
be free.
I was
It should
excited
be
when I
free.
started reading the contract, I saw 2, and then I kept reading, and I was like,
Oh,
Right.
someone said a square foot before, so they came to 2.
I mean, if we get a
And I know
G-Pace
you
motorhome,
originally had
we just sit
dollars.
out there and do services out of the parking lot for free.
So,
If your rent
you
is,
need to get a snowplow, I'll start mowing the lawn.
if your rent is $2 a square foot and it goes
Actually,
to
I have a
$4 a
tractor
square
with a
foot,
brush on.
your rent is
Let's-
double.
Let's pool our resources.
Yeah.
Yeah, no, that's, no. See?
Oh,
I- Did you hear what you just said?
Yes.
I mean, no. No, the more square foot you have, the better deal you
Throwing the
get.
2 minutes out the window here.
Yeah. Right.
All right, so I would like to make public comment to the board. I would, with this,
You want to be last.
yes.
Oh, okay.
For this rent negotiations with the commissioners, I would encourage you to iron out the material terms with the board and then bring those to the prosecutor's office rather than the other way around, because who knows how long it's gonna take for that contract to come. And they're not gonna be filling in the material terms of it. Sounds like you're pretty close. I think putting a floor on the dollar per square foot for the basement is good. Seems very reasonable to kind of have the stair-step approach, and then have terms for people to weigh and consider when the contract is reopened. Like, these are the factors that should be weighed and considered, because it's gonna be a completely different group of people that are gonna be in charge. So I think that would be a good way to approach it. In respect to the state of Ohio and this rent-seeking issue you're dealing with, I would encourage you to be as thoughtful as you can how to apply pressure back onto the state. I don't think you guys are volunteering your time to extract money from taxpayers and just send it to rent seekers. So what buttons can you press and what sort of leverage can you exert on the state of Ohio? I don't know what that is, but I would encourage you to seek that, because you shouldn't have to come back to taxpayers and ask for more money just to ship it off to some board. So that was my public comment.
And if the board, so if you guys still want to email me your requests for the contract, the reason I asked that the original time was kind of what Matt just said. I mean, I'd rather just give them to Linda up front, and then Linda being our prosecutor, she can then say yes or no to things. Like, she may say like, hey, this is not something you put in a contract. Yes, it is. But at least then she has an idea of what you all want.
Right.
Because it does take a while to get responses, because she has a lot of other cases.
But that could also be in our favor.
It could.
There
It
you
could.
go.
The length of time that it takes to go back and forth.
That-
But we
I
have a
think-
template of what they want.
Uh-huh. I don't think we should be rushing anything.
Okay.
I understand.
2025 is it, baby.
I will follow all of your leads. I mean, we're just trying to work with what you guys
For
need.
our 2026 budget.
There you go.
Yeah, I think we have.
Sounds a lot better.
A good sense of what you guys want, so you know, maybe putting it, crafting it on the front end first, sending it back up the pipeline.
I'll play it by ear with, if someone sends something, I'll send to Linda. If no one sends anything, I won't send to Linda. I mean, either way, I've got to talk to her on a couple topics, so we'll go from there. Linda, our attorney. So, any additional comments, questions, concerns?
I wanted to say real quick.
She's talking. Let's do it.
All right.
Again.
Date night's getting wild now.
With this rent thing, I mean, yes, they've come down and they're more reasonable, but it's still, you're given from one government agency to another government agency. It's all taxpayer money, you don't have it, and they do, they don't need it. So why are we giving it to them?
Well, that's been the $1 million question.
And have we heard back from the prosecutor yet on this latest thing? Because I wasn't here last month, so.
Sorry, which thing?
Whether we're paying it or whether we're a general district.
No, we do have to, we are a combined
Combined.
general health department, so we do have to pay.
We have to pay.
Well, sorry,
Where
they
is
can,
that?
they don't have to
They
charge
can't-
us.
right.
They are
They are
choosing to
choosing
charge
to
us.
charge.
And we
Right.
didn't, and the public health department did not pay prior to moving to
No.
that.
Correct.
And this
Right.
just came,
spontaneously,
They've
a
never
couple
paid.
months ago.
If we, you know, make
Right.
wages, it's
Yes.
wages.
Yeah,
Yeah, we're not trying to earn money here, we're trying to provide a service, and we simply need a place to do it. We didn't ask for a beautiful building, we were told we had to come here.
Yeah.
We didn't, really ask for a brand-new spot to be in. This is, where it's convenient for us to provide the service to our community.
Yeah, I'm happy that could,
There's a basement.
Help if we can, but.
Can you go check the lighting down there?
And the community will pay, I mean, I say this, I mean, the community pays one way or the other. I mean, they're paying taxes on something.
Yeah.
Our levy's only 0.2 mils, but the next one is gonna have to be higher than 0.2 mils, and it's gonna be that plus, now it's gonna have to be whatever rent is. And that plus if whatever accreditation is. I mean, those are, and we all pay taxes, none of us like to, and I'm sure, and it's just one more thing that all of us are being tacked on to. So.
And there may be a time that, expense of people's health, you just can't let that happen as a board. That's why you guys have survived.
The only thing I don't like, which I've voiced before, and I'll mention again, is I like being in this building next to water and soil, the water resource department, and then the building department. It makes it easier for the public. I dislike we'll be renters for life. There's never, at this rate, there's never a point that we say, hey, we've paid off a gajillion dollars, we want to be on our own. This is just forever now. And I mentioned before when we first saw this, that's the only thing I don't like about this is that
Not an investment.
yeah, it's not, there's nothing that we can say now from now on, like, hey, we're finally done. It's 2042, we're finally done. This is just forever. Yeah.
In fairness, though, these costs are electric and maintenance.
They're minimal.
And so we'd have to pay those costs even if we
Correct.
paid off a mortgage.
Right, yeah.
Mhm.
We
Oh,
could work
that's
a
all that
contract
it
to buy
is?
the space we want, could
Yeah.
we?
because I was
No,
gonna ask.
they're not offering that.
We had a bond that paid for this building, right?
That's my understanding. I mean,
Right.
I believe that's what
Yes.
the paper said, yes.
So they are not
So-
asking us to
So
pay.
they're only asking you to pay for utilities and snow removal and janitorial?
That's what,
Cost
Doesn't
of-
that number make sense
Why
once
the
we
Cost
get
of
to
operation and
$9
maintenance.
per square foot for utilities, and I'm not
So-
yet, but.
Why is the B and B paying 15 if that's
Uh,
all there is?
So that's where,
They're
that's where the
They're
state
for
didn't
profit.
say come down. The state said we pay, my understanding is the state said we can pay X, they took X.
Yeah, they-
Right.
It's not based on.
Because they have a
Oh, so-
funder.
Okay, so there's
Do
a
we even-
difference,
Yeah.
okay.
Yeah.
Do we know our utilities though? Do we know what we actually?
So they don't. So that's
Okay.
actually been a kind of a behind the scene conversation is when they gave us that, line item.
Yeah.
I looked at what was the CEI charges versus the Dynegy charges. So CEI is your distribution, your transmission, versus Dynegy would be like your electrons, that's the part you competitively source. And so the CEI charges were very, very high, the Dynegy charges were relatively low, and I said, this doesn't make sense, did you guys maybe switch these numbers? They said, no, we actually weren't in a contract. So for the first year that this building existed, they did not contract their electricity, so they were paying default CEI prices. So they paid over market for their power. So those costs where they're getting that $2 and whatever cents per square foot, they were paying more for power than they had to when they got those costs. That being said, power prices have gone up, will go up.
Yeah.
So so, I mean, those numbers that they're giving us, $4 a square foot and so forth, those are just projections, they really don't know. I don't think where their prices are gonna be, but I actually don't think it's bad.
Okay.
I actually
Yeah,
think it's.
I'm,
Yeah.
you know, looking pretty much blindly at this, that's my question, is if we know our utilities and that's reasonable, then it's reasonable to move forward with the price per square foot. The other stuff, not necessarily.
Yeah, I mean, but like, you know, there's snow removal, I don't think they really know any of those costs, they just know what it costs right now.
Yeah,
Right.
yeah, it's not gonna go up in a linear
I think they're
fashion, 1, 2,
guessing.
3, 4,
Snow,
5.
yeah,
Just take-
yeah.
I don't think anybody's
Snow.
know based
Yeah.
on the data that
Like-
they have.
We just,
Right. Yes.
this, the rent will be based on these criteria points.
Yeah,
These
it's
utilities
fine.
or whatever.
They say that it was based on.
Yeah,
Um,
so,
We're
Item
done,
is
is that
where?
done?
And
He
we
will.
trust.
all right.
Are we
Yeah,
at,
are we-
we're at the end
We
of
can
the
adjourn
public,
that.
Do we need executive
we're at the
session?
end of
Can I-
citizens' remarks?
Yeah,
Yeah.
you don't need an
Oh,
executive,
sorry.
right?
I don't, yeah.
You
You good, 2 minutes?
Thank you all,
All right, so it is.
It's adjourning,
and
Move to adjourn.
motion.
executive session,
I don't
No,
believe we have anything for that.
We move to adjourn.
meeting's adjourned.
All right.
Out of here.
6:47?
Yep,
are you
6:47.
sure?
Adjourned.
Meeting's adjourned.
All right. I told you, I'd tell you when it happened. August 10th, I graduated my master's. So I'm done.
Please go ahead.
I got that much longer.